Osteoporosis. Osteoporosis is an incurable medical condition that causes the bones to become frail and fragile. When the bones lose minerals such as calcium faster than the body can replace them, the bones lose strength and become more susceptible to fractures and breaks. Wrist, spinal and hip fractures are the most common parts of the skeletal system affected, but any bone can be. Osteoporosis usually has no onward symptoms until a fracture has occurred, which is why it's been named the silent disease. The disease affects over 1 million Australians and has a huge cost on society. Over 49,000 fractures in 2012 were due to osteoporosis. This is expected to grow to over 63,000 fractures a year, costing society over $7.5 billion a year. Some short-term effects of osteoporosis may include fractured bones. Fractured bones may cause reduced mobility, resulting in being unable to walk or participate in regular activities such as walking, driving, cooking, or playing with children. Fractured bones are always painful, and some even require hospital stays or in-house care. This can also increase risks of other health issues such as pneumonia. Being unable to participate in everyday activities, hospital stays, and pain can lead to some mental health issues such as depression. Some long-term effects may include permanent disability. Osteoporosis can cause permanent disabilities such as spinal fractures, resulting in an injury to the spinal cord and the surrounding nerves. The constant threat of a fracture can lead to the inability to participate in everyday activities as well as recreational activities. A change to your living arrangements may occur if you require a live-in nurse. You may also have to live with family or even a nursing home to provide you with mobility complications. Although death is an extreme consequence, lack of medical treatment can result in further injury or fatalities. Your quality of life may be impacted on through loss of self-esteem, which may lead to mental illness, a permanent disability, constant fractures, as well as medicational side effects. Osteoporosis affects over 1 million Australians. The main people affected include menopausal women, aging men, individuals with a genetic history, and people with less than ideal lifestyle factors. During the rapid decline in estrogen levels during menopause, bones lose calcium and other important minerals at a faster rate. Women going through menopause are much more likely to have osteoporosis. Men lose testosterone at a much slower rate than women. Therefore, their bone strength remains adequate till later on in life. Although the loss of testosterone through aging can increase the risk of osteoporosis, men can still have the health issue throughout life if they have bad lifestyle choices or have a genetic history of the disease. A family history of osteoporosis can indicate a higher level of risk for some individuals. If an individual has a genetic history of osteoporosis, they need to be aware at what else will increase of the risk. Lifestyle factors. A diet low in calcium and vitamin D significantly increases your risk of osteoporosis. Regular exercise over a long period of time significantly reduces the risk of osteoporosis. An individual who isn't physically active throughout their life, especially as a child, may have a much higher risk of osteoporosis. Osteoporosis is among countless other medical conditions that can be either caused or worsened by excessive alcohol and smoking. Being too thin or too heavy can increase the risk of osteoporosis. Protective strategies. Calcium is essential for maintaining bone strength and health. If there is not enough calcium found in your diet, your bones are stripped, therefore losing strength and density, making you vulnerable to osteoporosis. Less than half of Australian adults have the recommended amount of calcium in their diet. Although Australia is known for its sun, a large number of Australians have a vitamin D deficiency. The recommended vitamin D requirements are relatively low, only a few minutes a day in the summer and 2 to 3 hours a week in the winter. Vitamin D regulates the absorption of calcium in the body and is vital in the prevention of osteoporosis. Exercise is important in growing and maintaining bone strength, density, and health. Regular exercise over a long period of time will not only benefit your bones but also your muscles and general well-being. Organisations such as Osteoporosis Australia are working together to promote healthy bones for all Australians. The website and helplines have useful information and can direct people to places to access their risk of getting a diagnosis. Juvenile osteoporosis is rare, but not non-existent. It's usually due to the underlying medical problem or medication. Being active outdoors as a child is one of the best preventable measures against osteoporosis in adulthood and childhood there is. The best time to build bone mass is during childhood when the body is going through significant growth. This is very important in preventing osteoporosis later in life. With the development of new and easily accessible technologies, the children of the current generation spend an increased amount of time indoors, either in leisure time or at school. Considering this and the importance of vitamin D and physical activity, what will happen in the later years of their lives?